Good day, everyone. My name is Zizi Pomasiza. I'm from PsyCaD. Today, I will be interviewing a podiatrist at UJ Clinic Podiatry. His name is Mr. Simiso Nduli. So, sir, can you please just kindly tell us about yourself and your qualification?
My name is Simiso Nduli. I'm a podiatrist and a lecturer as well as the HOD of Podiatry Department at DFC campus. I graduated about 10 years ago from the University of Johannesburg with a degree in podiatry. I then studied with University of Stellenbosch to do a master's in management of HIV and AIDS. And then currently, as indicated earlier, I am the HOD clinician as well as lecturer at UJ Podiatry Department. The most interesting thing about my job at UJ is my interaction with patients and students in terms of lecturing as well as with the patients that we treat. The most challenging thing, again, is students and treating patients.
In your own words, can you explain to us what podiatry is?
So, podiatry is defined in a dictionary as a physician of the lower limb. But a podiatrist is someone who looks after the lower leg, which is the foot, the ankle, the knee, and the hip, in terms of the pathologies, the conditions that might present in those areas. So a podiatrist is defined as a doctor of the foot and the lower limb.
What are the popular institutions that offer this qualification?
The institutions that offers podiatry. Currently, UJ is the only university in Africa to offer podiatry. If you wanted to study podiatric medicine in the whole of Africa, you would actually have to be registered with us because we are the only institution that offers this program or this degree.
What are the required subjects to study podiatry?
The subjects that you would need to study podiatry, at grade 12 you would need to have maths, you would need to have physics, life sciences, and it goes without saying that your English has to be good because we do want you to be able to communicate with your patients. So again, it will be your mathematics, your physics, your life sciences, as well as your English. And in all of these, you have to have at least an APS score of a 5 and going above that.
What are the important skills and attributes that one needs to have in order to succeed in this career path?
Skills that would be important for you to be able to study or to pursue a career in podiatry would be basically your eye-hand coordination has to be good because we do a lot of cutting around people's feet and what have you. So you have to have good eye-hand coordination. You also have to be able to get on well with people. So you have to be able to communicate at all levels. If you think about doctors that might refer to you or if you need to refer to them. So you would have to have those skills if you wanted to pursue a career in podiatry.
What other career opportunities can one venture into after completing the podiatry qualification?
Career opportunities that one can get into once you qualify as a podiatrist, well, you can always go the most popular route, which would be to go and open up your own practice where you can see your patients and be your own boss. But currently and lately, most of our students are going into the public sector, which means as soon as they graduate, they go into public hospitals, your Charlotte Maxeke, your Tembisa hospitals, your Bara. Also the municipal clinics in terms of local clinics in your area, your Chawelo clinics in Soweto and so forth. These are areas where some of our students are getting into. So the other avenue that is being explored very well is if you've got interest in sports injuries. Most people are going to work for research centers in cases of Adidas, your Nike companies, where you can be more involved in the management of sports injuries.
What are some of the misconceptions people have about this qualification?
So the misconception about podiatry and this qualification, well, the first misconception is that this is a qualification for white people. This is a big thing. Currently in South Africa, we have less than 50 black podiatrists, which actually means that more and more people are thinking this is a white profession. So in terms of the black content, the podiatry is very badly represented. The second thing is that you only work with the elderly and you have to cut toenails and corns. So these are the two big misconceptions in our profession, that you would basically be stuck with grannies, and this is why most people run away. Podiatry is not about cutting toenails, cutting corns, or seeing old people. Podiatry is very diverse. It depends on an individual's interest. For example, if you're interested in rheumatoid arthritis, that could be your specialization. If it's diabetes, you could go into that. If it's HIV and AIDS, you could go into that. So just be careful. If someone tells you about corns and calluses, this is not what we do.
What advice can you give to someone who is interested in studying podiatry?
Advice that one can give to someone who wants to study podiatry, well, you really have to think that podiatry is like studying medicine, except you're compressing and fitting everything into and around the foot and the lower limb. So people have this idea that, oh, it's going to be easy. If I could not get into medicine, I'll just do podiatry. It is an intense course. You really need to know that when you come in, you are in for the long haul. But having said that, it is a very interesting, challenging, and dynamic career.
Which companies offer employment for podiatry graduates?
Companies that might offer employment to people after they graduate, well, as indicated earlier, the state is the biggest employer currently for healthcare professionals, both at tertiary institutions as well as your municipal levels. But also we've got footwear companies, your Adidas, your Nikes, and then the private health also. If you think about your Netcares and all those kind of companies, you can also get a job there. But most importantly, you could be your own boss, in that you can actually graduate and the following week you could have your own practice.
What is the entry-level salary for someone who studied podiatry?
The entry salary, let's say now you've graduated and you've got your space at Bara or any other public institution, you will start at about 180,000 to 200,000 rands per annum. That's not per month. That would be what the government will give you spread over 12 months. If you are in private practice, of course, your salary is determined by yourself in terms of the hours that you put in, as well as the number of patients that you will be seeing in your private practice.
Thank you so much, Mr. Ntuli, for your time. I do hope that our listeners learned one or two things about this qualification.